Hello, I'm Neil Jacobs, one of the orthopaedic foot and ankle surgeons, and I want to talk to you a little bit today about midfoot injuries. So the area I'm talking about is the tarsometatarsal joints and the show-parts joint between the talonavicular and calcaneocuboid joint. And the reason we want to talk about these is midfoot injuries are frequently missed. So with regards to the bones in more detail, we've got the talus and the calcaneum, and those two joints have the subtalar joint between them, which provides some inversion, eversion on the hind foot, and works in combination with the show parts joint complex here to give even more pronation, supination to the foot. The cuboid and the three cuneiforms and the navicular then articulate with the metatarsals. This is a fairly stiff joint complex and important in the structure of the foot arch, and the injuries in this area are frequently missed. And this is the Lisfranc joint complex. So the things to look out for on examining somebody with a foot injury are signs such as bruising on the sole of the foot. So plantar ecchymosis under the arch in this area or under the sole can be highly indicative of a significant midfoot injury. And anybody with plantar bruising and pain on weight bearing should be suspected for a Lisfranc injury, even in the absence of an obvious fracture on the x-rays. Other landmarks around the foot here, so the cuboid sits in this area. Sometimes the anterior process of the calcaneum, where the ligaments and capsules attach here, can be avulsed, and sometimes this can be a source of ongoing pain. Or cuboid can be fractured and not readily visible on the x-rays. So if pain is localizing in this area, a bit more proximal to the base of the fifth metatarsal in this area, think about the calcaneocuboid joint or the cuboid bone. The tarsometatarsal joints and the Lisfranc area is across this area, and you can sort of, if they're getting tenderness in this area or there is any obvious instability on manipulation of these joints, then again just have a low threshold of suspicion. With regards to general movements of the foot and ankle, your ankle movement in tibiotalar purely gives you this flexion extension at the ankle joint, and the heel should be moving. If we stabilise the talus and look at that side-to-side movement, that's subtalar joint movement. If I hold all of that hind foot and look at this more pronation, supination, that's creating movement through the show parts joint and the tarsometatarsal joints. So, on examining the foot, specific areas of tenderness, rather than just documenting pain and tenderness, it's always helpful for us to know exactly where the tenderness is, and you use that knowledge of the underlying anatomy. So base of fifth metatarsal, the cuboid, calcaneocuboid joint, anterior process of calcaneum, the actual different metatarsals, the different tarsometatarsal joints, the navicular, and then you've got the medial and lateral malleolus and the calcaneum itself, Achilles tendon insertion also. So really being specific on areas of tenderness is always helpful. If you've got a foot that isn't terribly bruised and the patient is hobbling a little bit, but it's in the back of your mind whether you could be missing something like a Lisfranc injury, then things you can do to just convince yourself this isn't the case are to sort of squeeze the forefoot and squeeze this midfoot region, and to stress each of these joints individually, and to confirm when they are weight bearing that they are genuinely loading the foot evenly and not just standing on the outer border of the foot. So if they're able to stand with their full weight on the foot and press down into this medial ray, if all those sorts of actions aren't eliciting pain, then you can be pretty confident that you're not missing a significant midfoot injury.